Welcome to the all viewers and well-wishers of the world. Purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn, and return. I have learned a lot, earned a lot. Now it's the time to return a lot to the word from where I have got the knowledge. The topic of today is discovery of Dr. Nasir. Since long I have been reading this, it is not always true that you are right and the rest of the world is wrong. But it may be true that you are right and the rest of the world is wrong. This has led to the greatest discoveries of the world, which are now the universal truth accepted. This gave me an encouragement why not I can do this in my field, which I did in my 35 year of clinical experience. So I have made certain discoveries and I have added these lectures to the medical literature which were not previously there, and I the first to put it in the medical literature. These are glucopenic headache, tissue paper mania, woman's lip reality. Already I have uploaded these lecture. Today I am going to upload the new and novel method of giving insulin injections and new method of giving insulin, as I am also diabetic, so I am just going to give these methods for the welfare of the other people also. Among all the medicine to treat diabetes, insulin is the only made by the God Almighty. Rest are all man-made. So a thing made by the God Almighty cannot be harmful for the human consumption. This has been said by the Dr. Christian Bernard in his book A Human Machine, that the things made by the God Almighty cannot be harmful for the human being. Insulin has got little or no side effect. Insulin is a hormone created by the beta cells of the pancreas that control the amount of the glucose in the bloodstream at any given moment, released when needed by the body to manage the sugar after the food intake. Insulin helps the body turn food into energy. It stores glucose in liver, fat, and muscles. It regulates body's metabolism of carbohydrate, fats, and proteins. Without proper insulin, body cannot store glucose in muscles or liver, cannot make any fat. Instead, the fat breaks down and produce keto acids. These keto acids, if they grow too high, that can cause the diabetic ketoacidosis, which is usually a fatal condition. Now, the invention of the insulin. Insulin was discovered by the Canadian surgeon Dr. Sir Frederick G. Banting and medical student Charles H. Best, which were helped by J.J.R. MacLeod at the University of the Toronto in 1921, and it was later purified by James B. Collip. In recognition, Banting and MacLeod were jointly awarded 1923 Nobel Prize in Physiology or Medicine. Banting split his half of the prize money with Best, and the MacLeod split the other half of the prize money with the Collip. Insulin was originally derived from the pancreas of the cows and the pigs, so-called porcine and the bovine insulin. Here are the two pioneers, Frederick Banting and Charles Best, those who just invented the insulin. Position of the husband is like a split AC. No matter how loud he is outside, but inside the house, he is designed to remain silent, cool, and controlled by the remote, which is with the wife usually. Now, the forms of the insulin, three forms. Animal insulin comes from the animal. Human insulin does not mean it comes from the human. Instead, a laboratory-made insulin, that is regular human insulin, neutral protamine, azidone, and pH, pre-mixed formulation, combine intermediate, long-acting, and either short or rapid acting. The other forms are the insulin analog, a type of the lab-grown human insulin, which is modified to affect how quickly or slowly it acts. These are the basal analog, glargine, Detamer, Degludec, then rapid analog, Lispro, Aspart, and glulicine, pre-mixed formulations. Now the types of the insulin, these depend upon the onset, peak, and duration. These are five main types of the insulin which the doctor prescribe and the patient do use: rapid acting, short acting, intermediate acting, long acting, and pre-mixed combination insulin. Now certain insulin which are without the syringe, these are the insulin pens, insulin pumps, jet injection, and inhaled insulin. Here one can see the syringe and the vial. Here one can see the pen with cartridge, and here it's the insulin pump that just automatically injects the insulin into your body through this tubing, and then it can be inhaled via inhaler, that is called inhaled insulin. Here one can see the syringe and vial. One can draw from the vial, and through the syringe one can inject. Now the pen fill, it have got the cartridge and the pen. One can see the pen and the cartridge which is separate. We put the cartridge inside the pen and put the needle, and this is ready. That is called insulin pen. Then there is pre-filled pen, in which you don't need to put the cartridge all the time. It is already filled with cartridge, so that is called pre-filled, and it is disposable. After using it, you have to dispose and get the new pen. Here is the insulin pump. That is the reservoir of the insulin that is injecting the insulin through this tubing and through this infusion site, and that is the glucose sensor, and through this it is going to transmit the signals to this pump, and this pump automatically gives insulin to this infusion site. Here one can see the infusion set, the tubing, and the insulin pump. And here again one can see it outside on your screen through this sensor, and one can inject the insulin through a remote control which is in your hand. So that is also a kind of more convenience for the patient. Then jet injection insulin. Here one can see the insulin is injected through a needle to the subcutaneous area. Here it is a needleless pump, your jet injection, which just push the insulin into the subcutaneous tissue, not with needle, but just with a jet. So that is inhaled insulin. One can see the freezer, it's just like the inhaler. One can have the medicine gone into the lungs and ultimately reaching to the blood. So by all means, you marry. If you get a good wife, you will be happy. If you get a bad one, you will become a philosopher. So the most of the philosophers, the genius people, they do not have the good wife, and they said that beyond the success of every man there is a woman. So the woman punishes and gives that much pain to the man, that man remain busy with his job and work, and ultimately he succeeds there. And that is said to be that behind every woman, behind every man, there is a woman for the success. So this is how a man can get success. So technique is, the aim is by different angles of the needle, you have to be there in the subcutaneous tissue, but not please enter into the muscle, because it is not intramuscular purpose. Here again one can see through the injection we are reaching there subcutaneous, then injection jet also we are reaching here in the subcutaneous tissue, and even through the insulin pump we are reaching to the subcutaneous tissue, and we are all sparing the muscle layer here. So the right and the wrong technique is, you just lift the skin along with the subcutaneous tissue, and at the angle of 90 you inject the insulin into the subcutaneous tissue, and do not just pull up the skin too tightly so that you are going to lift the subcutaneous tissue, and when you are going to inject the insulin, it is going to be in the muscles, and insulin is not for intramuscular use. Insulin injection sites, these shaded sites, these are all available in the literature, and I do not agree with all these because that is not so convenient. Here again, the site on the abdomen, because the problem is that you inject the needles very nearby on this small place, and here again you have to inject the 4 vials or the pens on this small place, which is going to cause the complication. Again here or this place you are going to inject the 4 injections or the 4 vials. I have developed a new method which I am going to tell you in the next slides. And again at this small place 4 injections, pen or vial can be given. Here on the leg 2 injections, and again on the leg 2 injections, which I don't agree. Here again, the small place, so many pricks. Small place, so many pricks. And all it lead to the complication. And what are the complications of the insulin therapy? Allergic reaction to the insulin cause burning and itching of the injection site, skin rash, anaphylactic shock if just one is not suitable to this insulin, and just treat by antihistamine and the glucocorticoid, and the change insulin to the pure pork or the human insulin, which is less allergic and causing reaction. Skin thickening occurs leather-like skin and insensitive. That is also by repeated injection on the same site and very nearby injection that makes the skin like a leather. Pain, itching, swelling, or the redness around the site of the injection. Pain at the time of the delivery of the injection is also a problem because that site have been multiply punctured previously by the needles, and still it does not have the time to heal properly and to give no pain for the next injection. So the complication continued. Lipoatrophy or the loss of the fat appears at the slight dimpling or splitting of the subcutaneous fat. Hypertrophy, development of the fibrofatty masses at the injection site that is caused by the repeated use of an injection site. And if insulin is injected at the scarred area, absorption is delayed. So rotation of the injection site is very important. Proper time to the injection site must be given so that it can heal properly and not going to have pain next time it is being punctured, not making any kind of scar. Here one can see the complication which are because of the injection, and that is the nearby close injection in the vicinity, and one can see the injuries, the bruises, the other wounds, that is because of the repeated injection and not giving the proper space and proper just away from the other injection site. Here one can also see the complication of the insulin and complication in the legs. Again, the complication in the abdomen. So one can enjoy the ice cream if you don't have the diabetes, but if you have, not try to have this. Now the new method developed by me, first you select the abdomen. You just make 2 parts of the abdomen from here to here. That is one half of the abdomen and the other half of the abdomen. Now you have to give first pen or the first vial to this whole area of abdomen, just half of the abdomen. One half of the abdomen is selected for 1 pen or 1 vial. Again, this part is divided into 2 parts. One is the thick skin which is on the near the midline. As you can feel yourself this is a thick skin. And here on the lateral side, this is a thin skin. Now, as a rule of giving insulin, the rule of 8 is applied by the American Diabetic Association, that if you are going to have the insulin 8 unit in the evening, you will have 16 unit in the morning. Similarly, the 16 unit in the evening, 24 unit in the morning. So rule of 8. Similarly, if you are going to have more insulin, you are going to have the rule of 8 and 32 unit and 24 unit in the morning. So now select. The morning units are always more. So you give the morning unit on this thick skin. And the same day, you are going to give the, suppose 24 here, the 16 unit, you are going to give it here at the thin skin. So 24 here and 16 here. Next day, 24 here, 16 here. Next day, 24 here and 16 here. So you are going to use and exhaust one pen and one vial, more here, less here, more here and less here. So when the first pen will be finished, you are going to have the second pen. Start here on this half of the abdomen. And this is going to be spared so that it can recover from the injuries of the needles and the bruises. Now you are going to use the second pen, and here again you can appreciate thick skin and thin skin. Again, second pen or vial. The larger units 24 or 32 here, and the lesser units 16 or 24 here. So 24 here, 16 here. 24, 16, 24, 16, 24. So you are going to exhaust the second pen. First pen here, second pen here. Now you are going to shift to the third pen. Third pen you are going to have on the leg. This is for the third pen. You are selecting the right leg. Here again you can see on the lateral side of the leg there is a thin skin, and on the medial side of the leg there is a thin skin. So the larger unit, again for example 24 here, 16 here, 24, 16, 24, 16, 24. So you are going to exhaust the third pen here, and then you are going to start the fourth pen here. Again, thick skin is on the outer side, lateral side, and the thin is here. Again, the larger units, 24 here, 16 here, 24 here, 16 here, 24, 16, 24, 16. So you are going to exhaust the fourth pen. And now you are going to have the fifth pen. But you are going to have the fifth pen again on this side of the abdomen. Sixth pen here. Seventh pen here. Eighth pen here. So you are going to give rest of at least 3 weeks to any injured side. An injured side that will be recovered in that much time. Now, what are the advantages of this new method? New unique method invented by me, as I am diabetic and I am using insulin. I am comfortable by using this method. More surface area is available, so there is a less chance of infection, less chance of the pain, because the skin already has recovered from the previous injury of the needle. Less chance of the complication like bruise or infection. Adequate time for the recovery after needle injury, and the distance between two pricks is more than 4 centimeters. I hope you will like this, and that is the end of my lecture. And if you like this is a new novel method, please just subscribe my lecture and share it with others. If you don't like, and if you have any query, please never hesitate to talk to me. And I'm thankful to you for having my lecture, giving time to that.